Om Shanti, everyone. Welcome to the Brahma Kumaris Next to Normal. I'm your host, Sister Jenna. We are so thrilled. We have a very, very special friend, brother, a physician that cares, Dr. Pratap from the Global Research Hospital in Mount Abu, India. You know, nowadays, healthcare, we tend to depend on our doctors. We look towards the institution of insurances and our physical, our medical physicians to be there for us when the body breaks down or even when the mind breaks down. And I know that in America right now, there are a lot of questions, concerns, fears. How are we going to maintain ourselves? Well, of course, you and I know if we are responsible for our bodies. You know, it's not that we keep drinking, smoking, not exercising, and making our bodies go down, and then we go to a hospital to get a pill. Those days are over. Physicians are so overwhelmed because we are not taking care of ourselves. And yes, there are very, very deep-rooted issues at a soul level that also creates illness that is beyond even our health care. Even as a vegetarian and somebody who I think is taking very good care of her body, still I get sick. Those are soul issues which are much deeper. But for those of us who really just don't take care of our body, we depend on our physicians, we depend on our hospitals, we depend that our insurance companies will help us to cover our costs. Many years ago, my mother, Sister Gita, who you watch regularly, used to go to this global hospital like it was her home. And Dr. Pratap is the chief physician there and the chief of staff for the hospitals, but now the managing trustee. It's not even just for a hospital, but for many hospitals. His love and his care only was focused on her well-being. Whether we had money or not, he focused on, is she okay? He would know her numbers. He would know if she was healthier, happier. He would call. This is the main person who was not looking at her physically, because there were other doctors doing. This was the individual who is appointed to take care of the well-being of the whole hospital, not one, two, or three, but many. I tell you why I think that's really important is to understand the intent of the person, the intent of the soul, who is, what you call it, the managing trustee of these hospitals, but of the instrument that is used to uplift the healthcare system. And so today we want to talk about the journey, the hospital, but also something that has become extremely important, medical tourism. Let's say if in the United States or wherever you are around the world, you don't feel that your country is really looking out for you, or you don't have the money to take care of your medical well-being, would you travel to another country and trust that they would be able to take good care of you? I know that for me, Dr. Pratap and what his role is in taking care of us in India has been a big help and a big provider. So today, I want to welcome to you in the studio, Dr. Pratap. Thank you so much for being with us today. You know, having you with me is like, I don't know if blessing is the right word, but very rare you find an individual that really cares from the heart and still handles all the administrational responsibilities that come on board. How do you do it?
Honestly speaking, these titles are only, like you have to work and maybe facilitate certain things with the government, with the people. People know that whom to report and how to do. We work as a team. At the Mount Abu Hospital, we work as a team, we work as a family, work as an organization, and we feel we are privileged, we have been honored to do the service of the humanity, the service of the community. The area which we are working is 43% is tribal population, the indigenous population who were not exposed to modern day medical care. And we started doing it, and now they come to us without any reluctance. They come to us for minor help. We have we have created such kind of confidence in the among us the people. I feel healthcare is a birthright. Everyone should have the healthcare, irrespective of the fact that whether he can afford or cannot afford. And Government of India has now kind of working towards universal health coverage. We call it Ayushman plan, wherein all the poor people below the poverty line are covered and they don't have to pay any cost. There's nothing on them. The government has insured them, and the insurance company pays the hospital. Besides that, as part of our community venture, we feel, as you were rightly saying, that health is not doctors and hospital, but before that, it is our self-responsibility. So we have to educate them. We have to go to them, give them a kind of screening programs. We screen them for eye care. We screen them for anemia. We screen them for cancer. We screen them for NCDs, non-communicable diseases, and educate them.
How easy is the education? Because
well, it is. They are receptive. They are receptive now. They are becoming aware that simple things, simple, basic, healthy principles. If they follow, then they can stay healthy.
Yeah.
They have to look after their children. Particularly the mothers, the women. They need to be educated the most. If you educate the women, I think the whole concept changes.
Oh, yeah, the whole country changes when you empower a woman.
Right.
So I know that your hospitals are taking care of a lot of the tribal communities, but there's so many individuals coming in from all over the world to Mount Abu. You're taking care of them too. What are some of the issues you bump into more?
Well, it's basically, it could be simple things and they could be complicated things. We are not very much tertiary care hospital, we are a secondary care hospital, although we have a urologist, we have a head and neck cancer surgeon, and then we have the facility of an MRI and a CT scan, and then we have a good, well-established lab where we can diagnose, we have a full-time pathologist. All that is there. But then, there are certain limitations that we don't have the tertiary care like cardiology or neurology. We just recently were lucky to find a neurosurgeon who's working with us now, looking at, taking care of the trauma or even something wrong with the, person like epilepsy or other things.
Oh, yeah.
So that is a recent start. But I feel we can do much for the people who require some kind of not only physical health but also mental support and counseling and all that. In addition to the modern medicine, we do have a department of Ayurveda, yoga, magnet therapy. We have a department of spirituality and well-being where we give them positive thinking, meditation and counseling. That makes a lot of difference. And people can have, so many things. But more than that is the environment of the hospital. It's very powerful because of the people who are working there, majority of them regularly meditate. Majority of them regularly converse, they talk to the patients. And also we serve them vegetarian food, which is like a prasad. We would first the food is cooked and then offered to God as a prasad, and then it is served to everyone else, even the staff, the patients. And more important is, the interaction between the team. It is very important. The team works very smoothly. So we have that kind of system wherein, people work together, they even discuss problems together and then try to resolve and improve the situation. We are now accredited by the National Board for Healthcare. We call it NABH for hospital. So it's a standards we have to maintain. And insurance companies also give credit to only NABH hospitals. So that we have been over the years develop our standards for quality assurance.
That's very good. How did you get a lot of the physicians to practice meditation? And think about this, everyone. Just think about this. If I went to my doctor in America or my hospital, and I walk in there, and all of my doctors, or at least 80% of the doctors and nurses and staff are meditators, I don't know what kind of I don't know what kind of hospital that would be in the US, Dr. Pratap. Could you bring that here? I think it would be amazing.
We are very fortunate. It is not easy to attract doctors to a remote place. We are very fortunate. You know, people, I would say there are people who are looking for money, there are people who are looking for position, and these are the people who are looking for service. They want to do service. They have to, you know, be managed. They have to look after their family or household. We pay them. It's not that we don't pay them. But then these are the people who are not too much ambitious. And we invite them, they come and work with us. And then some of them, they have been staying with us. Like I would say, our ENT specialist, who does go for meditation, he may not exactly follow the philosophy of Brahma Kumaris, but he's been with us since 95.
Wow.
You know, that's kind of, people do feel that this is a special place. Like our ophthalmologist, he's been with us. He came as a locum for some time, and now he's with us for so many years, almost 30 years.
Amazing.
But then, you know, it is, you have to really provide them all the help.
How did you encourage a lot of the physicians and the nurses to let them know how important it was for them to meditate or to find relaxation, for them to be comfortable in their profession and helping the patients?
Well, some of them were regular meditators when they joined us, but some of them were totally new. So it's like, I would say everything is, you catch up. When you are there, you catch up the environment, you catch up the principles of healthy living.
They could see the benefit of it in the hospitals.
Right. It takes time, but people do start feeling interested in meditation and our way of living.
Yeah. I have to say, whenever I come to the hospital, any one of them that you are the instrument for, it feels like home.
Well, you know, it's very important that the patient should feel at home.
Yeah.
Patient should feel comfortable. You know, he's a stranger to a new environment. Hospitals are not very hospitable, but we have to see that how we make them comfortable, how everything is looked after. And I've seen, even when I was working in a public facility, you know, patients are not able to judge the competence of the doctors, but they are able to judge how they interacted with the patient, how they were looked after, how the food was served. So is service, you know, when you serve someone, how do you really serve? What, as you said, the intent behind the action, which is very important. You know, intention makes all the difference.
Yeah, very true. So now, as you look at the hospital growing, it's going to be a big question for you. What have been your greatest challenges?
The challenges, you know, I would say, like we work as a trustee or instruments of God. The challenge is He takes care. But, you know, you do have physical restraint of physical resources. Our manpower is a big issue. We started training doctors in family medicine, then we started training ophthalmology also. We have started a nursing school so that we train our own manpower. We train optometrists. Likewise, we used to train the nursing aides also. So you, in a small place, you have to improvise.
Yeah.
You cannot be dependent upon for everything to others. You have to have your own resources. You train your own manpower. And it's a good that the young people who are coming forward to become nurses, the young people who come for becoming doctors, it's good that we are able to train them and then retain them, some of them, not all.
I've met quite a few, they're great kids. What's your greatest joy of running the hospitals?
Well, the greatest joy is to be of service.
Yeah.
You have to be availability. Greatest joy is that, okay, you have been able to establish something which no one would have done it in that small area. And then I find when I go to the tribal area, I find the young people coming forward to studies, which was not heard. This I go to the schools, we do school screening programs and other things, and I find young girls studying, which is very kind of was not imaginable a couple of years ago.
Amazing, amazing.
And then some of them even join our nursing school and nursing college for study in the nurses. Some come to work as a nursing aides. So that's very important that young people are getting employed. They feel productive, they feel happy that they're doing something. People who joined as a nursing aide, they were only high school, then they did their secondary schooling, then they became nurses, now they're working as nurses with them.
Beautiful, beautiful.
So the growth is there.
Wonderful. How many beds are in the hospitals now?
Well, at Mount Abu we have approximately 100 beds.
Wow.
Although we are not able to use the full quota, we are only using 80 beds.
Okay.
And then in Abu Road, in the trauma hospital, we have 36. In the eye hospital, we have 60. And then we have created another hospital in Jalore, which is about 150 kilometers.
Okay. Has that started building or?
Eye hospital, that's exclusive.
Okay.
There is 20-bedded hospital.
Okay.
And then we started a clinic in Baroda also. That was long time back.
Wonderful.
Recently we started a breast cancer screening unit for the people who come to the ashram, and they are dedicated, they are not, so they require screening. So we started a small screening unit for breast cancer.
Wonderful, wonderful. Why don't we show the world a little bit about what Global Hospital is and what it's doing? Shall we do that?
Well, Global Hospital was started, the trust was established in 89. The first hospital was started in 91.
Yeah.
Then we started a rural health center from which our community work started. Then in the course we started an eye hospital. Although the beginning was very humble, we started in a small unit, small space. Then we got another building which was donated. Sometimes I feel it's his magic. There was a lady from Florida, Orlando. She was married to an Indian. Her husband passed away, and he had left a will that she would like to do something for eye care. And then she left money on my table without even waiting for acknowledgement. And this is how we started our eye care.
Wow.
And
you love stories like that.
It's like people came forward. The latest, the Jalore Hospital, I would say, this gentleman was a professor of physics in a university. He retired and moved to his hometown. And he came to me, he wanted to start a hospital. And he sold his house, moved into a rented accommodation, and built the hospital for us.
Those are the kind of people I think are governed by God's light.
It's magical, I must say. But the only thing is, I feel you have to be very committed to your mission. You have to be honest, and people do come and join you to support you.
Beautiful. Why don't we watch online a little bit about Global Hospital through this video? Enjoy this video, everyone.
We are passing through difficult times. The second wave of corona pandemic caught all of us unaware. We really didn't imagine that this would go so fast and so many cases would emerge. We started with our first ward at Mount Abu on 4th of April, and suddenly there were a rush of cases. Not only mild cases, moderate cases, but also critical cases started coming. Then we added our intensive care, was also converted into COVID ICU.
Really, it was a tough job, as I said, because every day there would be almost 50 to 60 patients in OPD, and we already created 2 wards for COVID patients, and we have one dedicated ICU which was created for COVID patients, and it consisted of about 10 beds. Last few months, almost the wards were full with COVID patients. In ICU, whatever patients we were receiving, they were almost coming at the last gasping stage in a very, very bad shape. And most of them would go on ventilators. Some of them were managed with high flow oxygen and non-invasive ventilatory support. Initially, we had a lot of problem with oxygen cylinders, oxygen concentrators, and also the medicine chain link was poor. But gradually, all these teething problems were solved.
In the first pandemic wave till January, we had done somewhere around 1200 to 1300 CT scans, and in the last 2 months, like March and April, we have done something 2800 to 2900 CT scans. So CT scan is not only the confirmatory, not only it's highly specific as well as sensitive, and it is done in the second week of the infection. And apart from confirmation, it will also help in staging the disease severity by giving a score, whether it's mild, moderate, and severe. So by that we can determine which patient will go into the home treatment, which patient needs a hospital admission and ICU care or oxygen or SOS. So in that way, we are doing a high volume of work in this particular pandemic, in the middle of the pandemic. And as I speak, even today also we have been doing almost 30 to 35 patients of HRCT for COVID-19 patients.
We have been able to manage the show because of the support of friends and well-wishers from India. We were proactive. We started oxygen plant at both the places. It is a PSA plant, but the production was not to match our requirement. We had to outsource our oxygen supplies from Gujarat because Rajasthan was not able to get us the oxygen. So we were able to manage the show, but it was quite challenging. We were able to procure new ventilators to support the increased number of cases, but we still feel that the situation is not yet over because the whole country is passing through lockdown. And once the lockdown is lifted, how the situation would be, we still need to be guessing. We need to be on alert. We have been able to get even oxygen concentrated from Give India, which is a big support to us. And we are using it in our inpatient area at Mount Abu and Abu Road. We feel together we can cope up with these challenges, and Janki Foundation has always supported us during times of crisis. I'm sure our friends and well-wishers would definitely be more kind and generous to us. Thank you.
Well, I have to say that video that you all just watched was just a little bit of the work the hospital has been doing, and that was during the COVID time. A time when there wasn't any oxygen, the hospital had. A time when there weren't any beds, the hospital had. A time when doctors were stressed and nurses. Dr. Pratap and his team was able to be present and to be available to help everyone. I really want to emphasize, if anyone really wants to learn so much about the Global Hospital Research Center, I really recommend that you Google it online. For now, I want to take a pause for our Sister Gita effect and really listen to some of the sweetness of her words of wisdom. Here she is.
Original peace. It is not necessary to search for peace because it is within. Your original state is one of peace. External situations will pull you away from your peace. This one is doing this. This one is not doing this. If that is, you let them in, and your internal feelings can also pull you away. Tiredness, for example, leads us into irritability. Learn to be in charge of yourself and maintain your peace. Center your awareness on your spiritual form, which is a tiny star. It's a starlight point of light seated in the middle of your forehead. Really experience the difference between you, the sparkling star, and your body, the physical car, so to speak. Learn to detach yourself from the vehicle. Even a few moments of this practice, if done regularly, will return you to your natural state of peace. Tiredness will vanish, irritability too, and your actions will be filled with love for the self and for others. Peace is your original state. Om Shanti.
Sister Gita, thank you for your blessings and all your good wishes as you travel on to do service. So as we come to a closing with my interview with Dr. Pratap Midha, what's your future now for all the hospitals and the whole area of healthcare for you in India?
See, the future is definitely to provide more service, to have more broader facilities. And you know, our friend Nevabai, who was our managing trustee, the guiding light, who was the inspiration behind the whole hospital. His plan was to now go into specialty care like cardiology, neurology, gastroenterology, and all these facilities, because these are not non-existent. People have to travel to Ahmedabad or to Udaipur. So we are planning a small hospital, not very big, a 100-bedded unit, which would have all these facilities. And then plus we feel that the focus should be on mental health. The focus should be on rehabilitation, medicine, physiotherapy, occupational therapy, and also although we have Ayurveda in Mount Abu, but develop Ayurveda and kind of health promoting science at the foothills also. And we are creating a facility for senior citizens so that they can live there. They are managed holistically, not only physical nourishment but also mental nourishment. All that is our plan. And then focus on education, training more nurses, training more doctors. That all would be the focus. But the vital component is that we work together and reach out to those people who cannot afford to go bigger cities for healthcare. And I would say, well, we have to develop a kind of a corpus so that we can take care of more and more people. And I'm sure the support and from our friends and well-wishers would definitely be coming. And we would also try to use our resources in a judicious way. We're thinking of putting solar panels to generate electricity, to have water recycling, do a lot of plantation and all that. We should be able to start this project by end of August this year, and we're looking at 2 years time scale to complete it.
It's wonderful. How can our viewers support?
The most important is good wishes, the
Yes.
pure feelings for us, so that we carry on our work with more enthusiasm and more vigor. And rest, it is like what they call every drops makes the ocean. So every drop of help would make the huge impact on us.
Good, good. What's your message to the healthcare industry in America?
Well, not in America, but
the
even
world.
in India, we need to be more encompassing. Like focusing more on nutrition, more on exercise, more on spirituality, more on environment, make the environment friendly. It should be the healthcare should become focus on more on health promotion, not just curing the illnesses, but making people empowered like programs which we have been running for diabetics and heart patients. I feel if meditation and medicine are blended together, it can make a lot of impact.
Yes.
Because people need to learn how to take care of themselves. Once people get empowered, then probably the cost of healthcare would come down. People would fall less sick. And at Brahma Kumaris, we feel that transformation is required in our thinking also. You know, the kind of we live our lives, that need to change. Our routine needs to change. I would say, they say that early to rise and early to bed makes a person healthy and wealthy. This is a simple thing.
It's true.
And then good nutrition and good mobility, movement, and being happy
Yes.
and caring.
Yeah.
I read a book which said giving is something which should become integral part of our lives. Giving support, caring about people, looking for somewhere you can make a difference to the community. That would make large impact. The doctors have to really become the leaders in this.
Thank you so much, Dr.
Pleasure.
Pratap. Thank you. All right, everyone. I hope that you were inspired by today's conversation with Dr. Pratap from the Global Hospital Research Center, but also managing trustee in just an amazing and progressive movement of emotional, mental, spiritual, physical health care. I hope that as you watch this show over and over again, you might know a physician, a nurse, or a youth who wants to get involved with the healthcare industry. This might be a great beginning. To start with the intent of service, to serve, to care, to help. This has got to be the future. We have to start today. So thanks everyone for joining in, and please keep your mind and your bodies healthy, and don't forget to exercise, but also don't forget to think right. So thank you so much for joining us at the next normal. See you again tomorrow. Om Shanti. Take care.
Om Shanti.